So what are the key differences between private TRT and NHS TRT? And is one necessarily better than the other? My name is Dr. Mazar from Men's Medical Clinic. We're a specialist TRT clinic based in Leeds, but we have patients all over the UK. So this is a very, very common question I get from patients all the time. So, number one, treatment eligibility. So on the NHS, if you have low testosterone, you're only eligible for treatment depending on where you live, and every postcode is different, if your testosterone is between 6 to 8 nanomoles per litre or below. So once again, it depends where you live, it depends on local guidelines. There's a few reasons for this. So obviously the biggest reason is that the NHS provides free treatment, so it's a resource and their funding is limited. So although potentially men with higher testosterone levels may get benefit from treatment, they wouldn't be eligible for it on the NHS. A lot of private clinics will treat up to a total testosterone of 15 nanomoles per litre. And you may say, why is that? If you look at the studies, there's evidence that some men may develop symptoms of low testosterone if their levels go under 15. Now, it doesn't mean every man will, but there are some men that will. So for example, if we have a man who in his 30s and 40s, his testosterone level was 27, if 10 years later his testosterone has gone down and now it's only 13 or 14, it may cause symptoms because that is insufficient for that individual. So that's the first difference, is treatment eligibility. So with private TRT, you have a greater eligibility for potential treatment. The second difference is the options of TRT. So on the NHS, the most commonly prescribed options, the consultant will normally start with testo gel, and then if that doesn't work or that doesn't give good testosterone levels, they may move on to Nebido, which are 3 monthly injections. Very rarely, they may offer options such as Sustanon or testosterone enanthate, which are shorter acting testosterone medications, but you may only be allowed an injection every 3 to 4 weeks. So once again, it doesn't solve the issue of having peaks and troughs or having a roller coaster. So initially feeling a bit anxious, a bit sweaty after an injection, irritable or having poor sleep. And then later on for a week or two, you might feel good. And then before the next injection, you probably feel just as before you started on TRT. So tired again, low sex drive, low motivation, and all these issues. So it's really important to understand these key differences. Now, in private TRT, there's a lot more options for testosterone. So for example, cypionate is very commonly prescribed. And then you also have compounded creams, testosterone enanthate, Sustanon. These are the most commonly prescribed private TRT clinic options. So you just have more options available, which is always a good thing. Number 3, the protocols. So this is sort of related to point number 2. But once again, on the NHS, the protocols are quite strict. So it's attending every 12 weeks for a Nebido injection. And if you feel that you're flagging week 10 or week 11 on Nebido, it's often difficult to ask them to shorten the interval, or they may just tell you it's not an option. With private TRT, so for example, if we take cypionate as an option, I have patients who do daily microdosing for health reasons or symptom benefit, so they have a little bit of testosterone every day. I have patients who inject 2 to 3 times a week. I have patients who inject once a week. So the treatment is a lot more individualized for the patient. So it just allows for a lot of customization of treatment, and we can treat each patient as an individual rather than just following the guidelines strictly. Point number 4, fertility management. So if you have symptoms and you have low testosterone, you should be aware that TRT can affect fertility. On the NHS, they often may delay TRT until your family is completed. Privately, that may still be an option, but obviously if you're struggling, there are fertility management options. So off-license medication like Clomid or Clomiphene. HCG. So HCG is a medication which can maintain some fertility. And then you can also combine HCG with TRT. And there's other options such as HCG and HMG as well, which directly stimulates sperm production as well. So if you want to have children and you're going on TRT, there's a lot more options available. And then finally, the other big point is private TRT is obviously more accessible, easier for patients. So for example, when you do follow-up blood tests, the clinic should be contacting you to arrange that rather than you chasing up and finding difficulty in getting an appointment booked. When you get your results or something is slightly wrong or you're having side effects, it should be easy to contact the doctor and make some changes. Within the NHS, that can be difficult sometimes. Now, when is the NHS very good for a patient? So if you have complex blood tests, so maybe you have high prolactin, maybe you have a pituitary disorder, the NHS is amazing. You'll get MRI head scans, you'll get the correct investigations. Endocrinologists are very, very clever consultant doctors. The second thing is cost. So obviously private TRT can be costly. The NHS, you could get medication for free. So if there's financial considerations, then the NHS is great as well. And although I don't believe Testogel and Libido is as good as some of the private TRT options, some TRT is better than no TRT. So you can still get really good symptom resolution on Libido or Testogel. So these are important considerations, and I wouldn't say necessarily one is better than the other, but if your testosterone blood tests don't meet the guidelines, if fertility is something important for you, if you have the financial sort of means and you want more individualized treatment or more accessible care, then private TRT may be correct for you. And if not, you should consider NHS TRT if you're eligible for it. I hope this video has been helpful. My name is Dr. Mazhar from Men's Medical Clinic. If you've got any questions, leave them in the comment box below.